Welcome to ecarediary.com's Caregiver Tips and Clips. I'm your host Meghna Giridhar. Each week we will focus on a caregiving issue in the form of a short educational video. January is Cervical Cancer Awareness Month, and today we will focus on understanding what happens during cervical cancer. According to the American Cancer Society, about 12,900 cases of invasive cervical cancer will be diagnosed in the US, and approximately 4,100 women will die of this type of cancer every year. Non-invasive cervical cancers are 4 times more common than the cervical types. In recent years, the rates of death from cervical cancer have declined. Between the mid-1950s and the mid-1990s, the rate declined by 74%. That's been due to the use of the pap smear test that samples the cells on the surface of the cervix to detect early abnormal changes. The rate continues to decline today by about 4% per year. Cervical cancer occurs when abnormal cells on the cervix grow out of control. This cancer can often be successfully treated when it's found early through a pap smear test. If it's not treated, it may spread from the cervix to the vagina and then into deeper tissue layers of connective tissue around the uterus. It may also spread to the pelvic lymph nodes and other pelvic organs. Advanced stage cancer may spread to lymph nodes, to other organs in the pelvis, causing problems with kidney and bowel functions, and also problems related to the liver and lungs. Doctors are now getting a better understanding of the causes of cervical cancer and have identified some factors that put you at higher risk for developing the disease. HPV, or human papillomavirus, is a sexually transmitted infection and the most common cause of cervical cancer. There are more than 100 types of HPV, of which 40 infect the genital tract. Only certain types of HPV increase the cervical cancer risk. Some conditions such as HIV can make you more likely to get an HPV infection. There are high-risk types of HPV, and those who are infected with HPV most often clear the virus on their own and will not develop cervical cancer. HPV infection can cause changes in the cervical cells, which can then be picked up by a pap smear test. Recently, some doctors have started testing for HPV at the time of the pap smear. Smoking cigarettes or breathing secondhand smoke is another risk factor. Researchers have found substances from tobacco in the cervical mucus of smokers. These can be toxic to the cells of the cervix and contribute to the development of cervical cancer. The third risk factor is genetics. Studies suggest that women whose mother or sisters have had cervical cancer are more likely to develop the disease themselves. There are 3 more risk factors, of which the first one is high-risk sexual behaviors. This could mean having more than one sexual partner or having a sexual partner who has more than one partner. Having intercourse at an early age, having unprotected sex, having genital warts, and multiple pregnancies are other issues. The peak age of developing cervical cancer is 47, but 47% of cervical cancers are seen in women younger than 35 years. Women over the age of 65 accounted for only 10% of cases. However, the number is increasing. Sadly, they're usually diagnosed at an advanced stage. Chlamydia is a common sexually transmitted infection of the reproductive tract and another major risk factor. This infection can be detected by your doctor. Recent studies have found that women whose blood tests show past or current chlamydia infection are at higher risk for cervical cancer than those that test negative. The best way to protect yourself from this cancer is to begin regular pap testing about 3 years after you become sexually active or at age 21. If you are over 65 years of age and have had normal pap tests in the last 10 years and no abnormal tests in the previous 20 years, further cervical cancer testing can stop. If you have a history of cervical cancer, weakened immune system, or DES exposure before birth, it is best to continue with routine screening with pap tests. There are 2 main resources for cervical cancer. The first one is the National Cervical Cancer Coalition, which is dedicated to helping women, family members, and caregivers battle issues related to the disease. Cancer Care is another important organization that provides free professional support services for people affected by cervical cancer. as well as cervical cancer treatment information and additional resources. Thank you for joining us today. To access more caregiver tips and clips, visit us at www.ecarediary.com. Until next time.